say that in this two-step, stabilizing healthcare costs requires system reforms that bend the cost curve, and there is whole and very new agreement about the importance of healthcare quality and healthcare value that is fundamentally different from where the dialogue was during the Clinton administration. So let me say this a different way. That part of the emerging healthcare reform proposals involve realigning system and payment incentives so that we're paying for quality of care and value, for evidence-based practice, for quality instead of quantity, and that is a very, very big change. So it's grounded in healthcare delivery system reforms like what is known as patient-centered medical home that Helen was referring to earlier, or pay for provider performance is something else it's called, for evidence-based practice. Community health centers are one of the best examples, community-based examples of providers who already do that. But the idea is to realign payment incentives to regulate both the private insurance market and the public payers, so that in fact we're paying more upfront than we are now for primary care, for prevention, for chronic care management, for comprehensive medical home, for the kinds of things that save money in the long run. Will they require upfront investment of dollars? Yes. Will they bend the cost curve in the long run? Yes. I'll also say this. Peter Orszag who's Obama's budget director of the White House Office of Management Budget, is trucking around D.C. armed with these Commonwealth Fund studies. There's lots of data and statistics that shows that, and this is sort of shocking, but fully 1/3 of the money that we as a country spend on health services does not improve health outcomes. So when you have a slide up there, it's, and I've seen 2.3 million. I think she had 2.4 million in 2.4 trillion. I'm sorry, 2.4 trillion dollars. Doesn't seem million, kind of close. 2.4 trillion dollars. I was using 2.3. It's between 2.3 and 2.4 trillion in 2008 on health services. 1/3 of 2.3 trillion dollars is $750 billion a year. Is that figure not familiar, folks? That was the amount of the bank bailout this past. $750 billion. If you could, this is already in the system. If you could save 1/5, 20% of that money already in the system that is wasted. That's 700. Again, that's 1/5 of it is $150 billion a year. That's $1.5 trillion over 10 years. Guess what? You could pay for health reform. You could pay for it without any additional money at all. Now, I will say that, but I'll also say the statement I just made is a little bit illusory. So I'm going to correct myself and say these reforms that bend the cost curve, that rid the system of waste, and I will tell you that some of the waste is that we pay specialists, and we pay some hospitals, and we pay some healthcare providers way too much, or we pay them to do things that are not appropriate or are not necessary. I'll just put it flat out there, because I have provider friends in here, but you need to hear it. You saw the statistics that Wendy put up there. It actually is true. Not pointing the finger at anybody, because we have wonderful people here. But it is in fact systemic. True. It's nobody. It's nobody. It's nobody. From what I can tell, at least in this panel, there's nobody. It's going to take time. The part of the debate in Congress is about how much is it going to cost, and it is clear that there's going to be some big upfront cost. That these are some of the savings we're talking about bending the cost curve occur over time. We're not going to get at $150 billion in savings in the first 5 years of the kinds of reforms we're talking about. Probably, at least that's what some of the but long term, we can bend the cost curve. And let me also say the major stakeholders, the major players, whether it's the business community, consumers, labor providers, healthcare plans, instead of fighting over this, they're actually coming together on how to work to improve value. Providers are at the national level too. So again, significant and helpful and really, really meaningful development. you heard it here, business community is pushing for health reform, and generally the greatest and most effective tiebreaker in difficult healthcare debates is the business community. And they are engaged more than ever before at the national level. In the 93-94 debate of the Clinton administration, the National Federation of Independent Business, the National Small Business Group actually actively lobbied against the national health reform proposal, helped kill it, in fact. Very different now demanding that something be done, and they're at the table. 6, quickly, all the major stakeholders actually are still at the table as details start to emerge about these congressional proposals. Some of the relationships with some of the players are likely to fray a little bit, and they may even be starting now. If anybody's been paying attention to the news over the last week, they may be starting now. But having said that, there is some widespread sense that the risk of not doing anything is greater than the risk of change. And you've heard some of that from this panel, I think, or say it a different way, that the more powerful special interests who may have special influence in Congress and elsewhere, whether it's the pharmaceutical manufacturers, the health insurance carriers, the major healthcare providers, get that the baseline of the healthcare system is absolutely unsustainable. And right now they also get that the reaction over time may be far worse publicly and in Congress than it is now. So the current policy debate is something that they can live with. So there's some tension in this, but that's one of the factors going on. Let me say lastly, in terms of this, why health reform is likely to happen. The president and congressional leaders they're serious about this. I mean, and it's important to know this. They have scheduled intensive public hearings and expert roundtables in the process. There is at least preliminary bill language that's already come out. Bills are supposed to be on the floor of the Senate and House by late July. They're supposed to actually, they still are saying they're on schedule for the Senate and House to vote on bills before the August recess. They're looking at a conference committee between the House and Senate in September, possibly. They want to get a bill to the president's desk by October or November. It is a quick time frame, but so it almost sounds too quick for a lot of us. But President Obama, who is not a person to be trifled with, has said again and again that healthcare reform in America cannot wait. It must not wait. And it will not wait another year. And unless we thought he was kidding, I'll take I think most of you may know the U.S. Senate has 100 members. They have special rules in the United States Senate about filibustering. So you can, unless you have 60 votes in the U.S. Senate, 60 out of 100, pretty big majority, you can't prevent a filibuster. So on any bill that may be controversial, a minority can stop it if the majority doesn't have 60 votes. Well, what congressional leaders did in consultation with the White House, when they were doing their budget resolution, they passed something called, or they're allowing for something called budget reconciliation. A lot of you may have seen this in the news. They passed a specific budget resolution only has to pass under Senate rules by a majority. So by a majority, they passed a resolution in the House and Senate saying that if a national health reform legislation had not passed the House and Senate by October 15th of this year, that they could use the budget reconciliation process to pass national health reform. The budget reconciliation process only requires 51 votes. Huge leverage with those in the minority, those who may otherwise oppose health reform, and those particularly in Republican ranks. And I don't want to sound like I'm being partisan here, but for those of the other persuasion, of the minority persuasion, who may otherwise have been proposed, they're having to take a very careful look at how they're going to draw lines and whether they're going to draw lines. So all of that interesting and very promising.